things that can make you sick: allergens, contaminated food and water, and racism. Hey folks, welcome to D-News, Laci Green here. My favorite commercials are those ones that are like, did you know that stress is terrible for your health? Yeah, stress can lead to high blood pressure and suppressed immune system and diabetes, and then you're like, oh great, now I get to be stressed out about being stressed out. Man, stress is like a bad cycle, and it's a cycle that affects some folks more than others. A new study published in the journal Sociological Inquiry found that after analyzing data from 30,000 people, racial minorities had significantly higher rates of stress, and it's symbolic of a great divide between the health of the dominant race versus the minority race in countries around the world. It's well documented that minority groups in the US have way more stress, poorer mental health, and poor physical health than white Americans. Racial minorities get sick more, their illness is more severe, it happens at younger ages, and they die sooner than white people do. In the US, New Zealand, and Canada, the average lifespan of male minorities is 7 years shorter than the white male average in the country. In Australia, it's 21 years shorter. So the big question here is why? It's a tricky puzzle, peeps. Lots of pieces, more than a short YouTube video could ever hope to place. But there are a few key factors here: racial discrimination, class, and education level. A study at the University of Western Australia found that Aboriginal participants were 5 times as likely to report negative treatment based on their race and twice as likely to have health problems. The American Journal of Public Health found that even anticipating racism, which minorities commonly experience with racial profiling policies like stop and frisk, is enough to trigger a harmful stress response. The British Medical Journal published a study finding that those who initially screened negative for all mental illnesses were twice as likely to have deteriorating mental health when they experienced racial discrimination. So these are some of the reasons why scientists are calling for racial prejudices, from interpersonal types like being suspicious of someone because they're black, to systemic types like providing little funding for schools in the ghetto, to be addressed not only as a social justice issue, but as a public health issue. At a conference in Switzerland last week focused on addressing racial health disparities, researchers laid out what they think can be done about this. The first is to recognize that there's something that's not quite right here. Second is to say, nuh-uh, inequality is not cool. And lastly, to make real changes that will better the health of minority groups. So next stop, end global poverty. Thanks for joining me, friends. Don't forget to subscribe to D-News for 2 new science updates every single day. Yeah, that's how much we love you. I'll see you next time.